Hello guys, this is my presentation on oral health among low-class Hispanic communities by Oscar Juarez. To start off the presentation, we're going to talk about the overview of oral health. Many dental issues occur in low-income communities due to the lack of insurance or money to pay for treatment. We know nowadays dental treatments can vary in prices and it can be very hard to pay for. According to Han, race/ethnicity is an important stratification factor in oral health disparities and due to uneven distribution of dental care and socioeconomic status among different racial groups. Therefore, some racial groups have it easier compared to others when it comes to getting dental care due to their socioeconomic status and specifically insurance and all that. Also, according to Barker, Latinos of all ages have the lowest dental utilization rate of all the ethnic/racial groups, with Mexican Americans having the lowest utilization rate of all Latino groups. Here's a brief overview of the income differences. According to Azari, income inequalities are probably the largest contributors to oral health disparities. Low income reduces the chance of having seen a dental provider over the past year. In 2010, annual dental visits were 42% and 70% in individuals above and below 200% of the federal poverty line. And according to my chart here, there's the income of non-Hispanic whites, non-Hispanic blacks, English-speaking Hispanics, and Spanish-speaking Hispanics. As you can see from this, over 70% of Hispanics make $45,000 or less in a year. Some of that is used to go to bills and everything, and dental care is not the main priority, which is why it can lead to this, in fact, irregular dental visits. Due to the low amount of money, like I just mentioned, Hispanics visit the dental office less than any other ethnicity. According to my graph here, less than 30% of Hispanics visit a dental office every 6 months or less for checkups. And about 25% of Hispanics tend to go every 5 years or never, which is something we want to improve here. Because 5 years or never, there can be many issues going on between those 5 years, and if you never come, there's definitely some work that needs to be done there. And when it comes to caries among children, we know that Hispanic people tend to not go to the dental office as often, meaning that children will have to pay for this as well. Caries are the most chronic oral health disorder in children. Caries can lead to more severe issues such as periodontitis and tooth loss. According to my chart here, almost 60% of white children presented with 2 caries or less, while less than 20% of Hispanic children presented with 2 caries or less. It sounds good at the beginning, but then when you get to the next statistic, that's where you start realizing that Hispanic communities do suffer a lot when it comes to caries. About 50% of Hispanic children presented with 6 or more caries compared to 35% in blacks and 15% in whites. This all has to correlate with the irregular dental visits and the low income of the family. Low income means less dental visits, means less problems when it comes to oral health. What can us, the dental hygienists, do about it? As a hygienist, there are many things we can do to help out the poor Latino community in order to maintain good oral health. The first step is to bring awareness. Bringing awareness is always the key factor. Social media is huge nowadays, and we should use it to our benefit to give tips to people on how to maintain their oral health, on what things they should get, certain toothbrushes, certain floss, techniques we could teach them. We could show it how to type it on, and hopefully that's the way we could spread the word. Also, helping out Spanish-speaking Hispanics by making them feel comfortable and establishing a nice relationship so they can take the oral health care more seriously. There was a statistic that said that many Hispanics do not go to dental offices because of the language barrier. They are scared because they always think they're going to scam them since they do not understand what is going on. And then lastly, the thing we could do is participate in healthcare drives that help out poor communities. There's usually a lot of healthcare drives that help out communities, that people do not have insurance, that can't afford dental care, and we should definitely take part in those to improve overall healthcare. These are my references. Thank you very much.